Thank you for your attention to this brief disclaimer before we begin the show. Dr. Joy Evers owns Hardison Medical Corporation, a Hero customer and participant in the Hero Provider Directory. Discussion of Hero in this episode reflects her experience using the platform in her practice. This episode includes discussion of Hero and medication adherence. Any adherence figures mentioned are based on internal Hero device data, using dispense events and cup removal events as a proxy for adherence. The device does not confirm ingestion. Results may vary. This podcast is for general information only and not medical, legal, or regulatory advice.
Welcome to Your Doctor Wants to Quit, a podcast inspired by the need to save healthcare in America. I am Dr. Joy, a board-certified emergency physician, and I created this podcast to shed light on the challenges our healthcare system is facing through the multiple lenses of doctors, other healthcare professionals, and patients. By listening and working together, I believe we can fix healthcare in America for all of us.
I think the role of technologies in general is to free up humans, particularly in fields like healthcare or where there's any human lives at risk, to really focus on those really important interventions or moments where the knowledge base and the experience set is fundamental to a positive outcome. In every field, the best of the best will be even more lauded and rare and valuable in their field because of the adoption of AI and technology. And I think that'll certainly be true in healthcare as well. But if you're not learning and you're not playing to be the best or provide high value care to your patients, then yeah, I think it's going to be an interesting time. I think mediocrity is not going to be rewarded.
You are hearing the voice of Kal Vepuri, serial entrepreneur, healthcare innovator, and thought leader whose life's work lives at the intersection of technology, health, and human behavior.
My name's Kal Vepuri. I'm the CEO and founder of Hero, and I am also the founder of Brainchild Holdings, which is a separate but related firm. My parents are both from India. They had sort of a classic Indian upbringing. They were very educated, but came from very modest beginnings in rural parts of India. Education was really important to both of their families. They then went on to get introduced through an arranged marriage, which was popular at the time. And the reason they were arranged is because they both had a deep interest in two things. One, healthcare, and two, the United States. So they wanted to move to the United States and they wanted to be in healthcare. My mother was a physician who was interested in surgery, and my father was a biochemical engineer who was interested in pharmaceuticals. And so they moved to the US, and I was born not too long thereafter. And I saw basically kind of two sides, two very important sides of the US healthcare system my entire life for child. On one side, my mother would spend, day in and day out caring for patients, largely geriatric patients who had chronic disease. And my father and, his entire sort of group of partners and team would focus on manufacturing low-cost drugs to support most chronic diseases in the United States. He had worked for a number of different companies who were in the manufacturing space, and then he started off as an entrepreneur himself in the 80s with I guess you'd call it a tablet press, which he started off, his first customer was a pharmacy, and he made private label animal vitamins for kids for that pharmacy. So that's how he got started. And then he moved into prescription medications, and then now into a number of different areas, including branded drugs and medicines as well. So, and encompassing both small molecules and more complex large molecules. I saw chronic disease through both lenses my entire life. And I really, to be honest, I found it incredibly complex. I remember as a kid and even as an adult in college and immediately after, there was something really intimidating about healthcare in the United States. And I think for a lot of people, it's incredibly intimidating. And so, my early life scared me out of a personal interest in healthcare, to be honest. And it wasn't until later in life when my mother started to have some healthcare challenges of her own that I started to sort of, study the field out of genuine curiosity and sort of, took a first principles approach to try to learn, or I should say dissect, I guess, the complexity from the outside in. And it was, a pretty painful process. It took me about a decade of my life professionally to understand how the U.S. healthcare system worked at even a, I would say a sort of a modest level, so more breadth than depth. And then with my mother's illness, was able to dive in a little bit deeper with respect to pretty typical disease areas, diabetes and heart disease, and get a better understanding of both sort of chronic disease management for those who are inflicted with those challenges, but also the therapies and the lifestyle changes and the sort of preventative techniques that can help people avoid the common sort of trajectory of diabetes and heart disease that we see in America so frequently, and other parts of the world, candidly, as well. South Asians in particular have a pretty high occurrence rate in these two categories. I, as an individual, and we as a family, had a very newfound sort of appreciation for those two areas in particular. So that was, I guess, a long way of me saying it was a windy road. And unfortunately, the last 10 years with both as an investor and a founder, a lot of my motivation came from personal experience with what was happening in my own family.
When his mother got sick, Kal became intimately aware of the physical, logistical, and emotional challenges that accompany complex medication regimens. The difficulty his mother experienced compelled him to create solutions to reduce the burden of living with chronic disease, starting with the invention of a personal medication dispenser. But as we spoke more about his mother, it became clear to me that it wasn't just about her illness. Rather, it was everything she had taught him by her own example leading up to that moment.
She was a practicing physician. She had ambitions of surgery as a young physician student, but I was born and made that pretty challenging. So she switched into the GP world, the general practitioner world. That was her career, focused on largely geriatric care, but also care for folks who had, multiple chronic conditions. She was, I guess the sort of American vision of their local doctor, somebody who spent as much time was necessary with each patient and took the Hippocratic Oath to the nth degree in terms of really trying to, understand what was going to help each patient day in and day out. And so she was not a financially driven physician, I would say, in many ways. I think she, in many ways, like the vision behind Healthtopia, was focused on every single person in a way that I think is just really hard to do given the incentives in the healthcare system. So she was a unique person and somebody who received a lot of love from the community that she served. She was a deeply respected physician and somebody who loved to learn. So I grew up going to bed, and seeing my mother with all of her medical magazines and journals spread out on the dinner table, just, reading all night long, just out of interest and curiosity. And again, she's one of those folks who would have been an amazing specialty, physician in whatever field she would have chosen to go into, but life didn't have that in the plan for her. And so she just kept studying because of her own interest. So that to me also had an impact just in terms of how I think about life, which is, pursue your interests. There's lots of, amazing reading and knowledge out there to be had. So regardless of, your life situation or what's holding you back, there's always something to learn.
Sounds like she was a really big inspiration to you.
She was, yeah. And even with, Hero, which was objectively inspired by her. We bring a lot of that to the mission that we use to serve our members every day.
So you mentioned that it took you about 10 years to really begin to understand the healthcare system and medicine as a field and how you could intersect with it. What were some of the things that surprised you that you were not expecting, and why do you think it was so difficult?
It's a great question. I would say, and these are certainly not unique to me, but the first thing is that the incentive system in the United States certainly is not really set up to be in the best interests of any of the day-to-day participants in the healthcare system. So whether that's physicians, or patients or caregivers, it's really, really hard to get a clear view of why and what and whom should be doing things based on the incentives that are laid out in the marketplace. And so from my perspective, I sit in this sort of innovator sort of seat for the most part. And it's a challenging environment for folks who want to move fast to live in because of some of these sort of frameworks that you have to live in. And that's just a part of life here in our country, which, is still the largest by far healthcare economy in the world. And so we have that blessing, but on the flip side, we have the curse of complexity. So that was probably the largest sort of wake up call for me. Again, not unique to me. I think a lot of people, see that challenge. The other was sort of how impersonal it was in general. Healthcare as a user or a patient, information was not really transferable. Everything was really hard to do. So if you wanted to, everything from changing an appointment to, transferring health records or accessing health records to scheduling, to getting feedback from a physician, to getting two physicians to speak about a single subject even, these were just really like impossible things, which was crazy to me, coming out of technology and in other areas, collaboration and discourse were just like kind of the status quo. So that was a real interesting learning as well. So similar to the first point, just creates a ton of inefficiency. In my mind, between those two learnings, you've got sort of 100x the complexity to get anything done in this really important industry. And thankfully, there's people who are willing to make that, jump and bet, like yourself, our team included. It's a labor of love as much as it is a daily pursuit, right? Commercial pursuit. So most of the folks that I know in healthcare could more easily build a financial success in a lot of other fields. So this is definitely one of those where your heart has to be in it.
Yeah, it's definitely. I think that what you're getting at is just the rigidity of how things are structured, which all ties into what is covered by insurance, what is actually a reimbursable service. If there's not a code for that, there's not an incentive to do that. And it might be the right thing to do, but it's not going to get paid. And so I think that you're kind of hitting on one of the most important things about our healthcare system and what it's going to take to make things better. It moves slowly. It's a slow-moving beast, and innovation is really difficult when things move so slowly. And the reason it moves slowly is because it's so highly regulated. And so it's not like we can just randomly come up with new mechanisms for payment for services that might be amazing and life-changing for patients. We have to go through a whole process to get that approved that can take years. It really stifles our ability to move forward, and with the pace at which new discoveries are happening, whether it's in science or technology, things that can really support helping people stay healthy and helping things be more efficient and less costly. It just takes so long to implement those things that by the time you can actually implement them from a regulatory standpoint, it's almost like we've advanced beyond that at that point and you're already behind the curve. That's been my experience, at least. And that's, I think, one of the biggest challenges. But I think another challenge is that it's an industry that's hard to understand as an outsider. I don't mean that it's too complicated or you're not smart enough to understand it. It's just having been in the healthcare system as a provider, there's so many nuances and things that are unexpected because they're not logical. Workarounds and quirks that are only things you would know if you worked in the field, that make it really difficult for someone on the outside to come in and innovate because it's hard to anticipate what the pitfalls are going to be. I'm not sure if that makes sense to you or if you've encountered that.
Yeah, I'm laughing because my team has these Cal-isms that I say to them every single day. One of them is the devil's in the details. And, obviously grandmas have been saying that for centuries now, but it's one of my favorite sayings. In healthcare, I think it rings true more so than pretty much anywhere else. And it relates to, I think, what you're saying, which is we work with folks who do the hard work. We partner with providers who receive a decade of training, then they have an apprenticeship model, really, right, as residents and then even young physicians, right, to sort of get up to speed on how the world works. And why is that? It's because this is just not one of those things that you can do after, reading a couple of books, right? It is really complicated. It involves obviously people's lives, but the details of executing the job of a provider in healthcare in the United States is one where about 20% of it is all of that training, and probably 80% of it is process, right? It's billing, it's, team management, it's HR, it's contract negotiation, it's prior auth stuff, it's research if you have the time for that, it's publishing, it's marketing. God forbid physicians do marketing, CME credit, all these things. That's just the provider perspective, but you can translate that to really every stakeholder in healthcare. So as a result, it's built to move slow, right? There's really no way around it. And it's healthy for healthcare to be thoughtful and considered, and, for us as a country to be really careful, right, with how healthcare progresses. But by that same logic, if you are holding back progress, and not even innovation, but just progress, right, in terms of process, efficiencies, and speed for the practice of care, the ultimate outcome there is that you're either going to have a continued cost challenge where we spend more money on care than on a dollar basis, than any other place on the planet, and we have worse outcomes. And that is not sustainable, unfortunately.
Yeah. That is a big problem. Like, the statistics would show that 30% of our healthcare budget is not really spent on patient care. It's spent on administrative functions to regulate the industry and to regulate doctors. And I think that is the biggest proportion of any country in terms of the spend on the administrative piece of healthcare. And so I think it is representative of what we're talking about, that we are so tightly regulated, and it costs money to actually regulate ourselves. And so how much regulation is too much, and when are we stifling progress? I think those are big ethical questions that don't have easy answers. I mean, If you make it too easy to change quickly, then, that can also create problems too, because then we're not being thoughtful, as you said, and we're not being methodical, and we might be implementing something that could cause harm or could become expensive and doesn't really deliver on the outcomes that it promised to deliver on. And at the same time, if it takes years to implement something new, then there's a lot of benefit that's being lost in that waiting period. And a lot of people that could, be healthier and drive costs down as well.
Totally. Ultimately, it comes down to also just sort of ROI, right? I think we would all be okay if we spent more than everyone else in the world, but we had proportionally better outcomes, right? That would be great. I think we'd all be fine with that. In fact, we're certainly more fine with it. And so that's sort of the part that I'm trying to, kind of focus on, which is, all right, if you can't materially lower cost quickly, which I'm not arguing that that's a true or false statement. I think, of course, there's a lot of great technology being unleashed in the world, particularly around AI, software tools that you're probably starting to use, and a lot of other folks are in the healthcare world. And that's great, and that's going to reduce cost, and it's going to improve efficiency, and that's amazing. But how do you get the actual return on that in terms of, health span and sort of quality of life, right, as well? So those are harder things to do, right? Cutting costs, improving efficiency, using AI to improve the efficiency of a practice, to improve auditing, to improve billing, right? These are like clear first order to-dos, right? That I think everybody's really focused on, and that's great. But what really matters is, like, if I'm twice as old as I am today, am I better off than somebody that age now then, right? And I don't know if we're moving in that direction yet. It's not just a technology problem, it's an accessibility problem, it's an engagement problem, it's a sort of a friction problem. And that ties to the patient experience, right? Not what's happening in the infrastructure of healthcare. And that patient experience has not really improved in a material way at scale yet.
Well, it's interesting to think about just even where we sat before the COVID-19 pandemic in 2019 or early 2020. just looking back on that, which wasn't that long ago, there was no telehealth essentially. I mean, there was some telehealth in rural areas, but for all intents and purposes, there was no material use of telehealth. And now telehealth is ubiquitous. It's a daily part of what we do as physicians, and it's a common experience for people accessing health services to access them through telehealth. And really, the only reason we didn't have telehealth before, it wasn't because the technology didn't exist, it's because it wasn't going to ever get covered, because the government had decided that we should reimburse for telehealth services, except for in very particular circumstances where there were major barriers in accessing care. And then because the pandemic led to a global shutdown where there was essentially risk to show up to the doctor's office, they had to act quickly, which never happens, but the pandemic forced their arm on that. They had to act quickly to actually create new codes and change the codes for billing and reimbursement to facilitate reimbursement of telehealth visits so people could still get care. And so it took a global pandemic to make telehealth ubiquitous. And the crazy thing is, it still hasn't been solidified in law that telehealth is going to persist forever. I mean, I can't imagine us ever rolling that back because there would be mutiny, I think. It's just such a convenient way to access care. Patients would be upset if that got taken away. But for whatever reason, we can't get the government to pass legislation to solidify the fact that telehealth is going to become a permanent part of how we deliver health services in the United States 5-6 years later from when this event occurred. And that is such a simple fix, an easy example, and we can't even get that done. So it kind of speaks to, some of these other more complex problems that might have innovative solutions. If we can't even get telehealth visits permanently covered through insurance because the government's holding us back, it's so hard to get other things done that might be more nuanced than just a simple telehealth visit.
Yeah, it's it's incentives, right? I can't remember if this is a direct Charlie Munger quote or not, but it's close, which is Charlie Munger being, Warren Buffett's late business partner at Berkshire Hathaway. But I think he said, show me an incentive and I'll show you an outcome or something like that, which effectively, I think is, really apropos in healthcare, because incentives are so complex to unravel and understand. And a lot of the opacity and the sort of gunk in the system is because of that, whether it's trying to get permanent legislation around telehealth or like you alluded to, or, there's medications that we take, even over-the-counter stuff, that still has like tentative labels, right? I mean, that have been out for like 20 years, right? And there's some really esoteric reason for all of these things that like we don't know, right? Like no individual knows, but it's just some complex web of historical things that have happened. And there's a black box that makes up that decision or lack of decision. And that's brutal, So my hope is that there's some amount of transparency that also starts to happen or play out in this next inning of healthcare in our country. I think the fact, like the health information exchanges are like one really important or at least valuable step in that direction, for example. And, I'm not expecting that to happen overnight, but I'm just excited about it and I'm hopeful around it. Certainly we try to do that in our little corner of the universe with respect to people being able to provide information to their providers and any other stakeholders in their care with respect to what exactly they're taking from a medication perspective, not just what's been prescribed to them or delivered to their doorstep. But, that's one of 10,000 endpoints, right? That would be really valuable for everybody to understand and to be able to do that in real time, not just as somebody's primary care physician, but anybody in the system that ends up having to care for that patient at any time, not to mention the patient themselves and their families and research and science, right? Taking all of that information and be able to do more good with it. The baby steps have started and I'm hoping that they accelerate.
Yeah, the regulation of data and information is a big issue. Part of it is for patient privacy. Historically, it's been tightly regulated in terms of the flow of information through HIPAA, but there's perverse incentives to hold on to data too.
Data is really complicated, to your point, because because of all the risks that come with holding data.
Right. And transparency, when you say the word transparency, I think of not just data transparency, but also price transparency. I think that's one of the challenges that is unique to healthcare. It's hard to think of another industry where you have the consumer in a backseat role in terms of how they show support for something with their dollars, because there's the intermediary of the insurance companies. You might have a consumer who feels that a particular type of service is high value, but they have no power. They are powerless to vote for that service by using their dollars, right? Because they're essentially subject to whatever their insurance company will pay for. And so this disassociation between like the consumer and then how consumers reward industry for performance and value is a big problem. And it makes it hard to predict the market dynamics and like how like new products are going to be successful, but it also makes it hard to reward progress because you don't have the person who's the recipient of that value in a position to use their wallet to reward that provider of that service.
Totally. Yeah, I mean, it is unlike any other service, right? Where you have no idea what the cost of the service you're paying for really truly is.
We don't know the cost of the services either, honestly. Like as doctors, I mean, we never really know what we're going to get paid. We cross our fingers that we're going to get something close to the average that's previously been reported. But insurance companies can change their reimbursement rates. And as a small business, we don't have any negotiating power at all. Even the large healthcare organizations have a hard time negotiating their contracts. So yeah, the provider of the service doesn't set the price. Essentially, the government sets the price through CMS because Medicare is used as a standard that other health insurance companies measure themselves against in terms of their reimbursement rates. And so yeah, we don't know what the cost of services are. We're always trying to hedge what they're going to be, and we find out what they are once we get paid, and then we use that to predict the future. But it's really tricky.
Yep. Yeah, it's price transparency, and I think without it, the incentives are always going to be challenged. There's no direct connectivity between what a patient is quote unquote paying for and the quality of the service they're going to receive. Yeah. Not to mention like the ROI of that, because it's going to vary so much depending on where they go and get that service provided to them. And there's this really, I mean, not to go on like a long set of tangents, but this sort of ties back to the complexity point, but employers are responsible for providing health insurance to their employees in this country for the most part, outside of Medicare, of course. And that's sort of an interesting legacy structure, right? Why has that happened? Why does it continue to persist? And there's sort of some interesting historical reasons for it, academically around how the country's economy shifted from agriculture to the Industrial Revolution and so on and so forth, and protecting individuals. And at the time, I think it probably did make a lot of sense. But we sort of live in a world now where there is potential for price transparency, and there's actually some really interesting companies being built that are trying to move in that direction. And my hope is, to your point, that translates to providers being able to have a more certainty on their business, right? Their revenue and what their business model should look like and how they can add and change services just like any other company or business would. So this is one of those areas where I'm very hopeful, and I think we're starting to see some folks offer up some interesting solutions to consumers. And I actually think there's a decent shot that some of the largest healthcare companies that are built will actually do a tremendous amount of good because they were going to go consumer first and provide that price transparency in a way that allows individuals to vote with their dollar, which is, I think, what you were kind of alluding to, right? Giving people the ability to sort of say, like, hey, this is where I'm getting the best bang for my healthcare buck. I'd like to, concentrate there and sort of let the free markets, work in healthcare like any other industry, or most other industries at least. So I'm hopeful, but like we were saying earlier, like anything else in healthcare, things just take a really long time. And so this is not a 3-year endeavor. This is a many decade, sort of process that we're going to go through.
So this discussion actually prompts me to ask you a question, which maybe isn't really fair because you're sitting on the side of industry. But I think there are a lot of people out there on both sides of the argument of would it make sense to have a nationalized healthcare system, basically Medicare for all, that kind of thing. And I feel like we've been having this argument for decades, literally since the onset of managed care in like the 60s. We've been having this discussion. And I think it's a tricky one, but there is an argument to be made that healthcare is a public service and it's a limited resource, and that there should not be a multiple tiered system, where like from an ethical standpoint, that regardless of your ability to pay, that you should have access to top quality health services. And I would tend to lean in that camp. I feel like I've structured our business that way. We don't do concierge medicine. We are trying to provide access to all people to high quality care. It's hard to sometimes function in that model as a primary care practice, but I think that it's the right thing to do. I think there's two things that create perverse incentives. One is we have people that invest in healthcare that are financially motivated and not particularly motivated by outcomes. So I think that's one challenge. And then also there's the challenge of the government, because they're not financially motivated per se, doesn't act quickly, doesn't have a sense of urgency, can't innovate, can't make changes that are in the best interest of people, because we're so bogged down with all of this regulation and there's no incentive. And so I'm curious where you fall in that discussion in terms of your perspective on like what would be best. Like if you were to have the keys to design, the healthcare system, what would it look like?
Yeah. Well, we could do a many session podcast on this, I guess, but I won't bore you with the sort of extended version. I would say the challenge, I think, theoretically with Medicare for all or a single payer system, just for because that's really what it is, right? It's sort of like, well, let's look at other countries like the UK with NHS or, as an interesting comparison or others like it, which is pretty much every other country in the world, other than ours, right? Which has such a developed private payer system. The challenge is quality of care, its own forms of friction for the patient, because you now are, offering a government service, and government services tend not to be particularly high satisfaction, right? And high efficiency. So that's I think, the biggest challenge. But on the flip side, when a government can negotiate pricing, whether it's drugs or otherwise, you're going to get much better prices just given the sheer scale of that consolidation of supply and demand, right? And through one single funnel. So you would theoretically see lower costs at the perfect asymptotic scale of that. And, you do see that in other countries, they get better drug pricing, but that's also because the US is here to subsidize a lot of that innovation through its private payer system. We pay the most for drugs, and as a result, drugs get invented and paid for here largely, and the rest of the world largely benefits from that. I'm simplifying, obviously, oversimplifying, and but that's kind of what happens practically. So, from my perspective, if I could flip a switch and we never had this private payer system, then in theory, I think it would be amazing to have a efficient single payer. I just don't know if that's realistic, right? Because when you look at the quality of care and how long it takes to receive care in developed countries that are single payer, it's not a great picture for the most part. And what you end up seeing happen is sort of shadow private payer programs getting developed on top of those markets. So the English-speaking places like Canada and the UK have their own vertical care, out-of-pocket programs that you can pay for that are concierge light all the way through sort of like mass luxury concierge programs. And so the haves get access to those programs and utilize them. And, as a result, they get faster response times and probably a higher satisfaction overall experience. And that might be okay. But the question is really what does that look like from a long-term ROI perspective? At the end of the day, I think academically it's interesting. And I don't think I have a specific position on this as my overall answer, but it's interesting to see that at the end of the day, we have the lowest ROI spend per capita in healthcare in the world. And we are the only sort of private payer-led economy, a healthcare economy, right? So it's more complex than that simplified statement, but it's just an interesting fact. And so, now the other thing I would say is important to note is that if you practically think about how to do something like that, it is an incredibly daunting task, right? Because you have such an entrenched system, there'd be a massive marginal cost to make that transition. And in the interim, you would have a massive balloon in costs that you would have to be able to manage through if you go from privatized to nationalized anything, right? Or vice versa. In history, there's a period of, extreme price and cost disruption that happens in the system that's really painful to go through for everybody. In this case, it would be taxpayers as well as, the people who are the stakeholders in care and the providers and the suppliers of care, right? So I don't know how that would play out. I can't imagine that it would be a process that also politically would be easy to sort of move towards. So I think fundamentally, I would love to see more acceleration of some of the things you mentioned, right? Price transparency, and services that offer high quality, high satisfaction care in a way that's measurable and provides real improvement in outcomes at modest or even lower costs than we see today. Ideally, all of those things. I think that's going to be the approach, is incremental change, compounding over time, and hopefully that compounding results in an overall systematic improvement over decades. That's my hope, bet, thesis, I guess. So, yeah.
Yeah, I think that's a very optimistic outlook on what might happen. I feel like.
Yeah, I mean, I am in the optimism business.
I'm worried it's going to get bad to worse before it gets better. No different than it took a pandemic for us to get telehealth covered. I feel like it takes some type of major pressure on the system to make substantial change in a way that creates more efficiency. So sorry to play devil's advocate, but I just don't see the incentives aligning for us to have that kind of incremental progress towards value. In fact, I would say that whoever the powers that be are that decide how to measure value are actually just making the problem worse, because they're imposing these artificial measures of value on healthcare providers. Unfortunately, what it takes to actually meet the quality metrics from an administrative reporting standpoint is actually creating more inefficiency in the system. And I think it's arguable that the quality metrics don't necessarily align with true quality. They're an artificial measure. And so although we may have a value-based care mindset philosophically among policymakers, I don't feel like anything that's being done at the policy level is moving us towards actual value-based care, which would mean better care and better outcomes for a lower cost. I feel like it's just kind of creating the rules that everyone has to play by, and everyone that is playing by the rules kind of knows that it's like fake. It's sort of like, all the benchmarking that's done, all of the, like reporting on like how many people are on statins in your practice and all of these things, that we have to report to the government. It's creating more administrative burden, and it's not necessarily what is leading to long-term better outcomes.
Mm-hmm.
And it's almost like it's creating its own industry. The value-based care industry is like yet another layer of overhead on top of what is already an expensive healthcare system. So I feel like there's got to be some serious disruption in how we as a country measure value of care. Because I think a lot of people are out there talking about value-based care and they're talking about all these metrics, but I don't feel like that's translating to the bedside directly to like the patient experience. We're just looking at these big aggregate population health statistics, and yet somehow when we compare ourselves to other countries, our outcomes are worse. So there's a big disconnect there, and how to step over that, I'm not sure. It's entrenched in the regulatory nature of our healthcare system in the United States, and it's becoming a bigger and bigger part of what we have to do as healthcare providers, and it's taking away time at the bedside.
Yeah. So lot to unpack there, but I would say on top of that, we haven't even touched upon the lifestyle challenges that we have as a country in terms of food and exercise and work-life balance and chemicals. There's a whole lot of media coming out of this administration and other folks about these items, and whatever your position is on all of them, they are things that we have to deal with. The fact that we have this obesity epidemic that's not going to change anytime soon, and all these other issues that are behavioral as well, and cultural as a country.
Yeah, I was just going to say exactly. And we don't reimburse for wellness care. We only reimburse for sick care. It's incredibly frustrating for us because in our practice, we're fortunate enough to have a lot of people that are really engaged with their health. They're coming to us because we offer something a little different, and they have to pay out of pocket for the services that we think should just be available to people through the normal primary care model because they're wellness oriented. It's expanded testing, like the cardiac marker testing.
Yep.
All the longevity medicine stuff that we do that's helping people stay healthier and have better quality of life for a longer period of time. All that stuff is not necessarily going to be covered by insurance because insurance, the premise of it is it's insurance, right? So you have insurance in case something goes wrong. That's the whole purpose of it, right? And so even just this idea of even calling it insurance, insurance is like you get in a car accident or you have a heart attack or something, you get cancer, right? You have insurance to cover the cost of that. But what about just the day-to-day wellness? And how do we start to shift how we're spending in healthcare so that it's further upstream and so that we're catching things before they become a bigger issue? The system is not incentivizing us to do that.
Totally.
The system, if anything, is compensating us high dollar values for expensive procedures for things that are further downstream rather than catching things that are upstream.
Yeah. So, I'll tell you, this podcast is not meant to be a podcast about Hero, but, our entire mission is to convert healthcare such that it becomes individual or customer or patient-centric, whatever sort of word you want to use.
On our podcast, we say person-centric.
Person-centric. Okay, great. And the way we do that is by solving really practically hard problems for them in their home. Obviously, medication management is the one that everyone sees today and that we have publicly commercialized to date. But these are challenges that are practical, they're reoccurring and foundational to their chronic disease journey, but also increasingly preventative need. If you can start to measure, pull in data from, obviously Apple Health Kit, and there's a bunch of other, Google Health, and now the various other hundreds of other biomeasure companies that are out there that are consumer oriented. Those have real adoption in the market, and you can pull a lot of valid signal out of that market and tie that to information that's in EMRs and coming from providers with respect to those individuals. And then if you add the medication or supplement or OTC picture in terms of what people are consuming day in and day out, you get a pretty remarkable view that didn't really exist before. And none of that really costs a ton of money. It costs a little bit of money, but it's not tens of thousands of dollars a year, right? You're talking an approachable amount of investment to get that information for folks. And if you can do that at higher scale and with consistency, you can start to incentivize people because the products are more passive or sort of lower friction to use, right? Whether that's, again, these biomeasure tools or quantified self tools, I guess people call them, or things like Hero, then you can start to sort of affect behavior by incentivizing people just using gamification techniques that, folks like Duolingo use, for example, with streaks and perks and community and social engagement to create a new connection to people's health personally. Because today, when you think about your health, it's sort of like this box, right? I have no idea what that even means, right? It's like, okay, my doctor knows what my health is, and I'm going to call them once a year. They're going to tell me what it is. And then, I'm going to move on with my life until there's an issue, and then I have to go deal with that, right? That's sort of the average person's perspective on what their health is, right? I'm a generally healthy person, or I've got this issue, right? Is sort of the status quo mentality around healthcare. And that really shouldn't be the case, right? You should actually be able to, in an approachable manner, understand the different major components of your health status And that is increasingly happening for people with some of these tools. Now, like I said, cost is definitely an issue, and that hopefully improves over time and becomes even more incremental versus material so that you can scale these out to everybody and everyone in a really accessible way. And when you can do that, then yeah, I think you're going to actually start to see, I mean, we see it certainly in our universe of when you put a hero in somebody's home, they engage with their health in a more positive manner, right? They just feel more connected to their provider. Even though all they're doing that's different today versus yesterday is they actually know what medication they're taking and they can see it, right? It's like an act that they used to do, maybe not as well, right? Because their adherence goes from, sub 50% to 90+% typically with Hero in their home. But it's not like they've totally changed what they've been doing. It's just the fact that there's some transparency and there's a tool that reduces all the friction for them. If you can start to do that at real scale, there's a tremendous amount of change you could see. Joy, you and I talk about this all the time, right? In terms of these simple digital interventions have actually tremendous impact on these people's lives.
They really do. I mean, people feel better because they notice the difference when they're taking their medication the way it's prescribed versus struggling to remember these complex dosing schedules across 10 different medications. And I think especially because the people who are utilizing the Hero, essentially all of them have multiple chronic illnesses, which is what draws them to the program. I mean, even for me, as a physician, I can imagine if I had to take 10 different medications and there were 5 different dosing schedules throughout the day, I would probably be the most non-adherent person, like who can manage that? It's so difficult. So like you said, when you reduce the friction and make it easy for people, especially when they have significant health issues, when they do take their medicine correctly, they feel better. And I talk to patients all the time that are like, I love my Hero. I feel so great. I'm doing so well. I love this thing. I'm never getting rid of it. It's changed my life. We hear that over and over again. And so you are then like kind of circling back and connecting to the patient experience, because it's not just something that is being done to them, right? They're participating and then they're feeling empowered and they're getting the benefit of the intervention. There's so much that is being done in healthcare right now from an innovation standpoint, or, even just policy that's happening. I feel like the patient often is forgotten in that. It feels very impersonal. We're looking at these kind of population health statistics and like broad outcomes, but change and innovation and improvement, it happens on the individual level, even if we study it at the population level. So yeah, it is really rewarding to see that immediate impact that's so profound. But how can we do more of that, right? How can we bring more innovation to people directly and hopefully figure out challenges with the incentives and how they're misaligned so that we can actually make a difference for people? I think that is hard.
Yeah.
It's really hard.
Yeah. It's just, there's a lot of conflicting incentives. And so you have to overcome them over time. And with clinical data and studies, ensuring that there's accessibility through reimbursement for as many people as possible, because that's the way the US system works, or finding your way into becoming a covered benefit for sort of everybody who needs it, right? It's through some other path. And so, and all that stuff, to your point, in this country, it's not going to happen overnight. For most things that really matter and are new, it just takes time. It just takes time. So, we're built for that. Our approach is one foot in front of the other. Obviously we want to move as quickly as we possibly can, but we recognize that these things take time, and I know you do too. It's not the most fun thing to have to hammer against, but it's important. When we hear from members about their experience with, Healthtopia and Hero, I mean, it's an incredible thing to sort of appreciate, right? And it's what keeps our team putting one foot in front of the other and serving more people every day. I think it's our job, ours meaning folks who are people who are stakeholders in the care of these individuals, to make it more apparent to the rest of the ecosystem that this stuff is doing really good things for these people, and to quantify that, right, with more and more information and data.
One of the things I wanted to ask you about is, because you're not a healthcare provider, but you were raised by one,
Yeah.
And obviously,
Yep.
you work with a lot of healthcare providers. What is your perspective on the role technology should play in healthcare? This topic comes up a lot on this podcast, and most of the time I'm interviewing other doctors or other
Yep.
people that are healthcare providers, and you're more coming from the tech side and the business side of things. I'm just curious what lens you see that through, because I think there's a lot of concern about the depersonalization of health services through the use of computers and tech and apps and AI and all of that stuff. So I'm just wondering where you've landed on that.
Yeah. So it's a really interesting question. When was the last time you took a flight?
Like maybe a couple months ago.
Right. And was it domestic, international? There's a point to this, I promise.
Domestic.
Okay. And so the answer to that question wouldn't have really mattered, but it gives context. So fundamentally, we don't actually need pilots to fly planes, right? There is an argument to be made that autopilot is better and more efficient and takes in all the sensors and does the things. Now, the counter argument to that is in situations where planes malfunctioned and people's lives are at risk, who saved the day? A human, right? And so while an imperfect analogy, I think there's sort of a similar challenge in healthcare where we're talking about a situation where people's lives are at daily risk, right? And for the vast majority of the issues that people face, a very, very highly trained system that takes a lot of really great inputs with perfect information, theoretically, could do a phenomenal job, probably, right? But that's not actually how the world works, right? There isn't perfect information. And no matter what, people are complex beings where things change in an analog way in their bodies, right? That if what's happening, no matter how good your tracking and biomeasures and Oura Ring or whatever are, that's going to require some level of, at least today, art to sort of decipher, right? And so my perspective is that, I guess my point to bringing up this sort of mediocre analogy is that I believe that there's a lot of value that technology provides in healthcare today and that it should provide that it doesn't yet. Obviously, as a technologist, I'm going to do everything I can in my sort of corner of the world, and hopefully that expands over time to make sure that that happens. And that's my life's work and goal. To sort of tie it back to, I think the real question you were asking was like, how does that affect the role of the provider, right, in this market? And I think the way it should affect the role of the provider is it should free up the provider to focus on those sort of, top of the pyramid questions, right? At the beginning of this podcast earlier, you were saying, we're spending all this time on administration and busy work. And I was saying, roughly based on everything we were hearing, like 80% of the time is not really on patient care. It's sort of other things, right? For independent physician practices. How do you solve that problem? Well, technology theoretically would be a great solution for a lot of that busy work, as it has been in a lot of different industries. And so that, I think, is the obvious answer. Like, that stuff really does need to get solved no matter what, using technology. And that should free up the physician to be able to focus on care, particularly in the scenarios where autopilot isn't good enough, right? Where it's like you've got a complex case, something is coming to a head, there's a question that's not being answered, there's an acute situation, meds stop working, there's all these scenarios that, you as a physician are dealing with all day that are really serious, and only you can provide value in that situation, right? Because you're the person who's trained and got all the pattern recognition and all the years of seeing patients to sort of rely on that history. And if not, then there's a network of other folks that you can call or address, or colleagues that you can talk to try to help you with that, right? Now, to your point, practically, that's not like a structural part of the world, but that's just your relationships that you've built that allow you to do that. And so I think that's my perspective, is I think the role of technologies is, in general, is to free up humans who are in any field, but particularly in fields like healthcare or where there's any human lives at risk, to really focus on those really important interventions or moments where the knowledge base and the experience set is fundamental to a positive outcome. Now, fundamentally, what does that mean for physicians? That's a more complicated question. In every field, the best of the best will be even more lauded and rare and valuable in their field because of the adoption of AI and technology broadly. And I think that'll certainly be true in healthcare as well. But if you're not learning and you're not playing to be the best or provide high value care to your patients, and I think it's going to be an interesting time. I think mediocrity is not going to be rewarded, right? And that's just not in healthcare, and I think in general.
I agree with you. The analogy of sometimes autopilot isn't good enough and you need a human being to intervene in unforeseen circumstances. I think that makes sense, and I can buy into that. I think that there's one piece that we're missing in this discussion, though, which is that human caring element. It's come up in this podcast before.
Mm-hmm.
And it kind of makes me circle back to what you said about your mom. She was well loved by her patients for her bedside manner and for her care and attention. And there's still something about healthcare that is personal, and that has to do with the human interaction. I mean, we call it a healing art sometimes, right? I would say that in my office, maybe 80% of what I discuss with my patients is not data-driven. We talk about the data, but then it's all the other social factors, and it's their value system in terms of how they want to pursue certain treatments or not pursue certain treatments, or they want to try lifestyle change, or they want to go the pharmaceutical route, or they're worried, or they're nervous, they have fears and insecurities. And it's a lot of counseling and coaching and hand-holding and listening, which I don't know that a robot can do it the same way. I mean, maybe they can.
For sure.
There's something about having a human being on the other side of that conversation that has the knowledge and experience to be a sounding board.
Yep.
That is a little different than AI. And I think also too, it's a trust factor. It's sort of like that idea, would you step onto a plane if you knew there wasn't someone flying it?
Totally.
I think that would make most people nervous these days.
Yeah.
You know what I mean? Especially
Totally. And that's kind of I should have ended my analogy with that, which is that's actually a fact, right? I mean, the reason why we have pilots, even though the vast majority of flights, don't really require much pilot intervention, is because I don't know about you, but I'm not getting on a plane without a pilot, right? There's sort of like this there's like a mental block, right? That makes it really hard for me to accept. So there may be like a biological component to this, right? We're hardwired to only trust, another human at the end of the day when it comes down to our livelihood, right? The beauty of the human is that they understand the gravity of a circumstance. When someone is really sick, that bedside manner, what that physician tells them about their situation could be the difference between that person even trying to live or not in those scenarios. And I've seen that happen before, where how a physician handled a particularly complex case, I believe, drove the outcome.
Totally. I mean, there's a lot of ethical dilemmas that are woven into day-to-day practice. Human beings have empathy. Human beings can see something from someone's perspective in an emotional way and use that as a guide to help as a sounding board or to help navigate complex decision making in a way that may not always be logical or in line with what research shows might lead to the best outcome as well, right? Like there are deviations from standard of care that are based on patient preference and patient value systems, and also kind of these unpredictable, like kind of outlier things that I think it's hard to put into a formula.
Yeah.
Because the model is only as good as the data that you feed it, that idea of garbage in, garbage out, right? If the model doesn't include the scenario that's at hand, it's sort of like the whole idea of the pilot, right?
Yeah.
The heroic measures to save lives and to keep the plane from crashing, that's when you really need the pilot. That's when you really need the physician too. But I think for physicians, it's not just when a doctor is analyzing a complex case. It's also when there are complex ethical challenges that inform how decisions need to be made. For example, end-of-life care, right? Mm-hmm. How do you decide to withdraw care? Can a robot decide that? I don't think so.
As a son, brother, husband, father, my daily life is spent trying to be as empathetic as possible with the people that I love and care about. And I think physicians are in the position of having to do that with strangers or patients. And the great ones do that, without missing a beat, day in and day out. And that's a difficult thing to replace with pure computation.
It's like, could you replace yourself, a father or a husband, with a robot?
Right. And
Would
that's
the robot
obviously
do as good of a job?
right. Yeah. And I guess sort of the devil's advocate point I made earlier was there's probably a bunch of stuff that it would do a better job at, to be honest, right? I mean, like, it would probably be better at like managing a schedule and paying the bills and, arranging for transportation and, setting a travel itinerary or vacation plan, right? Like, these are things that it would probably do a better job. And frankly, like, I use my personal AI tools to do those things. And that frees me up to be the empathetic human that people want to spend time with, right? And so I think we're in general agreement, but, to me, there's going to be a lot of surprisingly great things that these tools will be able to do for us. And, it'll start to feel like a true companion pretty soon for a lot of us professionally and personally, if it hasn't already, and that's going to free us up to do that great empathetic or creative or sort of artistic work that only, you can do. And so I think that's really exciting. And like I said, I'm in the business of optimism when it comes to this stuff, but that's not to say that it's going to happen, overnight or smoothly and, not ruffle feathers along the way. There's definitely going to be a period of adjustment for everyone as we move in that direction, providers, patients, families included. So,
Yeah, I mean, I had a patient actually just the other day on telehealth for a rash, and she was in her 30s, and she had a young child as well. And so she gets on the telehealth video chat and she says, I think I have shingles because ChatGPT told me it was shingles.
right.
I showed the AI robot this picture of my rash, and then I told it my symptoms, and it told me I have shingles. And then I looked at the picture she uploaded, and I said, yeah, you have shingles. You definitely have shingles. But it was all the other stuff, right? Like, do I keep breastfeeding my baby on this medication? There's not a clear-cut answer on that necessarily. What is the likelihood of me passing this to my grandmother who's in assisted living, who I want to go visit? I mean, maybe some of these questions could be answered by AI, but even just to think to ask them, like if the model doesn't know that you have all these other social factors circling around the acute issue, just kind of even having that conversation and talking through, okay, like, how do we manage this? And also just providing moral support, like, why am I getting shingles? I'm so young. This doesn't make any sense. I don't have any other health issues. And then just talking about stress levels and sleep and travel and all of these other things that are contributing. And then, what are we going to do to help boost immunity and sleep and things like that, help deal with stress management, all of that stuff, right? So it's one thing to make the diagnosis. It's another thing to think about all the other psychosocial aspects of any particular condition. Maybe we have a little bit of time before AI starts doing that for us. I don't know.
Yeah, it's going to be it's going to be an interesting time because things like this happen slowly and then really quickly, right? Sort of like, I don't know, the last time this happened was probably mobile phones, I guess. Internet adoption is a little more complicated because it was like, dependent on access to lots of different things. The whole mobile phone thing, right? I mean, remember that, wasn't a thing until one day everybody had a mobile phone and the world changed forever, right? And you just call everybody whenever you want and text them whenever you want, and then you start sharing images and all the things. And, that happened over, I don't know, roughly a 20-year period, right? Ish.
Mm-hmm.
So we're kind of in that same, probably 5 years into it, maybe a little less, right? Into that same sort of technological cycle that you tend to see for these sorts of things. And, as people gain more trust in the system, right? When people first had mobile phones, they're like, I don't want this thing tracking me, or I don't want this thing knowing what I'm searching for or who I'm texting and everything I'm messaging to everybody. And now people share everything about themselves over text, and their location and, everything that you'd be, shocked, right? What people are sharing with all these tools constantly, right? So to me, I think it's just a matter of time until you as a physician may actually just be talking to the companion of the patient, not the patient himself.
Maybe. I don't know.
The companion might
I guess
know
that's
the
possible.
The physician may know the companion. The companion may know the patient more objectively than the patient does.
It's possible, I guess. I don't know. It's going to be an interesting time. I know it's going to change things. I mean, I have no doubt about the fact that change is coming. It feels like a tsunami, and I feel like there's going to be a lot of things that are kind of disrupted in a way that creates chaos before we kind of like have
even out. Yeah, for sure.
Yeah, before everything evens out and gets to a place where we kind of know how to operate in this new normal.
Yeah.
It's going to be interesting. But I think, the main thing that I think is important for doctors as we navigate through this interesting time that's coming is to remember that our bedside manner and how we take care of people and our empathy, and those are the things that I think are the hardest to replace, that trusted counselor that we are to people. And I think the physicians that do that well are going to be successful, and the physicians that function more like robots, who don't have that empathy, are going to be easily replaced by computers. I mean, maybe not when it comes to like working with your hands, right? Like a procedural skill set might be harder to replace. We do have like robots that assist in surgery, but there's always someone in charge of that robot. So that, I think, is going to become its, own niche of like how we use technology to interface with procedures that are hands-on, and it's already starting as well. But yeah, the empathy piece, I think that's always going to be important. For sure. You may not agree, but I think it will be. I've got to believe that.
I do agree. That's exactly what I'm saying is I think empathy is the sort of key here. Right. And I would say empathy, and then like the sort of artistic, creative, aspects as well of being a physician, where, like you said, it's a really complex scenario. There's a lot of like non-obvious, inputs that need to be considered when you're looking at trying to diagnose a particular situation or help change behavior in a patient.
And all the tangentially related things that come into play that may not be part of the core issue at hand.
Totally. Yep. I wish people appreciated that healthcare at the end of the day really is a consumer service, right? Like anything else. And what that means is that top-down approaches or really didactic approaches to this service are not going to be the most productive in the long term, because patients are individual consumers, right? At the end of the day as well. And regardless of their state of health, for them to engage in a quote unquote care plan or in their health generally requires a really high satisfaction, low friction experience like any other consumer service. And so as a society, need to really start thinking that way, because through that would come things like price transparency and higher empathy interactions and a different incentive system in many cases.
I 100% agree with what you're saying. And what I would add to that is, because people are unique and individual in the way they see the world and the way that they want to live their lives, people don't have the same goals. And so they don't necessarily measure success in the same way. And so if you try to create a metric that measures successful outcome, that may not apply to a particular individual. So for example, some people would prefer to be on medication to treat some of their health issues, like whether it be high cholesterol or obesity or whatnot. Other people may be highly motivated to start running and train for a marathon, or go to a plant-based diet, or take supplements that are shown to reduce your lipids. So everyone is a little bit different. And so if you create a metric that says, if someone has a high cholesterol reading in their chart, we're going to measure success by whether or not they're taking a statin, that one singular approach may not work for everyone, or that person may not feel like that represents success. But yet that's kind of a top-down approach to looking at health outcomes versus what you're talking about, which is an individual level approach that each consumer essentially gets to determine for themselves, what does success look like for me? How do I want to be treated by my healthcare provider? What kind of options do I want to pursue within the range of options that are available to me? And that doesn't mean that, if we try a natural approach that it's always going to work, but maybe it does work, and maybe that's okay. Maybe the patient doesn't need to be on a statin, right?
Yeah.
So I feel like it's hard for me to even kind of admit this, but so I have a master's in public health. And when I studied public health, this was back in the early 2000s, and it was a population-based approach to things. That's what public health is kind of grounded in, is a population approach. But I would say that a lot of the things that I learned in public health school don't necessarily apply at the individual level at the bedside.
Mm-hmm.
Even of life care decisions, success isn't always measured in the days that someone stays alive. It could be measured in other ways, like quality of life, pain level, a particular goal of making it to my daughter's wedding and seeing her get married. And beyond that, I don't care, right? So all these social aspects of how people make decisions, emotional aspects of how people make decisions, things that speak to the core values of each individual are getting overlooked when we try to standardize things at the population level.
Yeah, I couldn't agree more with that.
And so, I think there is a value to having some population level data, because, we want to make sure that we're doing things in a way that's leading to good outcomes, but we can't measure everything that way. And we can't make that the only way that we measure success. I would say that I'm just going to make one counterpoint before we close to that whole idea of that the pilot is on the same plane that you are and their incentives are 100% aligned. I would say that there might be a handful of physicians out there, but I think it's the minority of physicians who aren't 100% in alignment with their patients. I do think that even though people may have disagreements on how to approach solving a problem, and that's normal, right? So physicians and their patients may not always agree on what the right path forward is, but I would say that we are extremely emotionally invested in the outcome. And even though the job to some extent requires a level of stoicism and impartiality, I guess, or maybe detachment from the outcome, because we can't always solve all problems, and it could be psychologically overwhelming to take that on. In terms of the emotional burden of carrying the weight of all the people that we have lost along the way. But I would say that the majority of my colleagues, we are emotionally invested in the outcome for our patients. And that is, I think, one of the things that makes the job so hard, because maybe on some level we're expected to be like robots, to just keep on marching forward. But there are so many times where we're dealing with our own emotional attachment to an outcome that was not what we had hoped for our patient, and still having to move on to the next person that we need to serve. And it's really taxing psychologically.
Mm-hmm.
And so I would just give a plug for the fact that, and I'm speaking for myself, but also for my physician colleagues, that we really do care. We really do care about the outcome, even though we don't always show it. We have to sometimes put on a front of kind of being impartial in order to function underneath of that. And sometimes, for the physicians that are very skilled at communicating and, appropriately interacting, but also showing empathy at the same time, I do think that the vast majority of us are extremely invested in the outcomes for our patients. It's why we went into this job in the first place, is because we care about people.
Yeah, I would say there are a few, I can't think of another sort of professional practice, right, that has to deal with that level of emotional vicissitude or volatility, or what you would call it. But it is a unreal expectation that is set on physicians, I think, to be able to be empathetic and yet objective.
We're I think all driven by our empathy. At least for me, that's what I lead with. And I have to balance that against the other competing interests. And I think most of us are wired that way, which makes us not the best business people, perhaps, but...
Well, there is that classic joke, I guess. But I will tell you that I think it's also hard to disagree with the statement you made earlier, which is it's the providers that are going to make patients comfortable and are truly the most empathetic that I think will be the most highly valued over time.
Thank you for listening to Your Doctor Wants to Quit. I'm Dr. Joy, a board-certified emergency physician, and I created this podcast because I'm on a quest to fix healthcare through conversation. If you liked what you heard today, please follow this podcast and share it with your family, friends, and colleagues. By spreading awareness, we can bring about change. You can also connect with me on Instagram at Dr. Joy MD. That's DOCTOR Joy MD.